I'm Jeff's here with Soma and Soul. I'm a licensed mental health therapist, and I get a lot of questions from the clients that I work with on how best to find an appropriate therapist for themselves or their family. So I want to go over a few tips today that might be of help to you when searching for a therapist. Tip number one is to ask your therapist how long they've been in practice. So this might be important to you. Um, Age doesn't necessarily show experience. And if you want someone who's more seasoned, that would be a great first question to ask. Tip number two is you can ask the mental health therapist what their licensure is. So, similar to medicine, there are different levels of licensure. The first level of licensure is the associate level, which means that your mental health therapist is practicing under a supervisor's license. This typically is the licensure that somebody gets directly after their graduate degree, and they work as an associate license under an associate license for 1 to 3 years. There's then full licensure, which means that they are working independently and not under anybody else's supervision. And then there is the licensure of a supervisor. That is my current license, which means that you have the ability to practice independently, but to also supervise newer clinicians with associate licenses in your state. The third tip I would ask is what are the types of therapy that the provider offers? So I'm not sure if you know this, but there are over 180 different types of psychotherapy that a therapist can be trained in. I personally am trained in something called somatic and transpersonal counseling. Somatic is a nervous system therapy that affects the body. And so we learn a lot about the physiology of the body as well as traditional talk therapy techniques. And transpersonal counseling incorporates spirituality into the therapeutic process. But like I said, there are over 180 different types of therapy that a therapist can be trained in. So this would be important. Similar to if you had cancer, you want to be making sure that you are not going to a provider who is recommending Benadryl for your cancer. You need the right medicine for the right issue. Okay. Um, Tip number 4 is asking how much they charge. So finances can be a barrier, as you know. So asking a provider right up front how much they charge and if they accept your insurance or if they are cash pay. This is important because we do a lot of work, even from the provider's end, on doing an intake and establishing a relationship. And if that provider is not financially feasible for you long term, that is going to be a barrier for your treatment. The last tip that I would say, and I would ask this directly of the provider after you share kind of high level what you're seeking help for. I would ask the provider directly if they have experience working with the issues that you are bringing to the table. Um, and if so, if they have experience, how many people exactly they have treated with your condition and what their success rate is. I'd be very curious to hear their answer, and they should have a good answer. If you are the first person they have seen with that condition, I'd be a little nervous about that. So, I wanted to just highlight that as the last tip. I hope this is helpful to you and in your taking care of your mental health. Please let me know if you have any other questions or need any other further tips on how to find a best mental health provider.